A very pleasant good day to all of our viewers. Welcome to another Let's Talk. It's my delight today to share. We have a very important subject. We are talking about wellness basics. The subject of wellness has occupied many a mind over recent years, and we are delighted today to begin the discussion. I'm pretty sure that we're going to go into part one, part two, and part three. But for now, we invite you to have a word of prayer with us as we go into this important discourse. Eternal Father and our God, we thank you for the opportunity and privilege of sharing on another Let's Talk. We pray that you will be with those who view around the world, and we ask for your guidance. Be with our guest today, grant him wisdom and simplicity so that as he shares and responds to the various questions, that those who listen will be enlightened. Thank you for hearing and answering in Jesus' name. Amen. Well, friends, we are today talking with Dr. Douglas Street. He is a medical doctor with over 20 years of experience. He currently works part-time at Faith Hospital in Cayman Brac. He has a passion for helping others prevent and treat their illness with natural interventions, especially lifestyle and diet. I like when I can talk to medical doctors who also emphasize natural healing. He's also passionate about teaching the Word of God. He's an elder, personal ministries leader, and assistant health ministries leader at the Creek Seventh Adventist Church on Cayman Brac. He's also the author of 3 published books, Beyond the Prescription, Reducing Inflammation, which gives guidance on how to prevent and beat illness naturally. He also has another book called The Blessing of Suffering, which gives guidance on dealing with suffering, and one called Power Up, Stories of Healthy Lifestyle for Kids, a collection of short stories that teach kids about healthy diet and lifestyle. He is the husband of Lorian Brigham Street and the father of 2 daughters, Allison and Azaria. Good day, Dr. Street, and welcome to Let's Talk.
Thank you very much, Pastor. Thank you for the introduction, and good day to your listeners, to your viewers.
Well, we're delighted to have you with us, Dr. Street. I'm very eager to know about how I can get copies of your books. They all seem very interesting. I don't know which one I favor. I am leaning towards the one on teaching children the principles of healthy lifestyle and dieting. That is, I believe, so important in today's world, but the other 2 are equally important. Maybe I should begin by asking you, and particularly about your first book, that one about, natural healing and reducing inflammation. What was your motivation for writing this book? And do you think that, given the fact that you have published it, is it making a difference? Can you share with us?
Okay. Well, when I was in medical school, there are some things that kind of stood out in my mind. One of the things that I realized was when I went into medicine, I thought I was going to be a healer. That was my expectation. I was going to be helping persons overcome their illnesses. But as time went by, I realized that there wasn't really much healing in medicine. Apart from, when you get a cut, then the cut heals. If you should get a cold, then you'll recover from that. But other than that, and of course, infections, bacterial infections, fungal infections, those can be treated. But other than that, most of the illnesses that we treat, they're really about maintenance. So diabetes is about controlling diabetes, blood pressure, high cholesterol. Those are not things that persons will recover from, really. So that was a little bit of a disappointment for me. And but of course, I kind of accepted it as being status quo. But there's something I said that kind of stood out in my mind, and I didn't really understand or try to process it too much. But later on, in my career, I began to realize that you could recover from those illnesses. And it wasn't something that was really being taught. And I remember one particular supplement that I was recommended for my clients, and I realized that it was able to help persons overcome several conditions at once. So that kind of opened up my eyes to the fact that there's a link between these illnesses. And there was one particular lady that I saw. She had hypertension, diabetes, high cholesterol. And that single supplement was able to control all three. And it went against, what we would have been taught in school, that medications are specific in terms of what they do. They treat blood pressure or blood sugar. And so it kind of got me thinking, well, how is it that this was possible? And when I looked at this supplement, I realized it was an antioxidant. So I realized that antioxidants treat inflammation. So I said, well, there must be a link between inflammation and these conditions. So I started to do some reading, went online, did some reading about inflammation and disease. I realized that it confirmed, what I was thinking, that there's a connection between chronic inflammation and all these different illnesses, all of them, whether it is anxiety, whether depression, whether diabetes, all of those conditions have a common link. So I was surprised because there was a lot of research that had been done. It was the first time that I was actually seeing anything about it. Didn't see anything about it in medical school or anywhere else. It was just because of my curiosity about it and my observation. So as time went by, I said, but I need to write about this thing. I need to let persons know that this is possible. I mean, there are some things, and of course, when I saw the results in my patients as well, there are several very outstanding results that I was getting. Persons who were having chronic ulcers, severe ulcerations in their legs, I was able to get them to recover, having complete healing of it, which they were being treated for medications for years, and within a matter of weeks, you could get this healing of this ulcer. Persons who had what we call blocked tubes, tubes or fallopian tubes were blocked. I was able to see where you treat them and I could get clearance of them. Persons with diabetes able to come off the medications. And I said, no, I need to write. So I started to do some research, reading, just to get, because being in the field of science, and you have to get scientific research to support what you're doing. So I started to gather the information together. And then what I did, of course, being an Adventist, I used that as a foundation, the New Start, program that we have. And what I did was just expand on those concepts using current research to support, what I was doing. And that was how it came about. So I published a book, and persons who read it, they were very, very, happy about the information, realizing that they could do more about their conditions, that they were told before. And some of my colleagues who I shared information with, they were very surprised because, of course, it's not something that we learn in medical school. So so since then I've been kind of building on the information, because as you know, in science, new information keeps on coming out. And so it's been a journey. And persons have benefited from it quite a bit. I said persons who are on medication be able to come off. But the thing is, one of the challenges is lifestyle change is not easy. So even though persons may know that this is possible, the commitment to following it tends to be a challenge.
Well, I have a few questions for you based on what you said. In fact, several. I'm thinking maybe we need to have an entire program devoted to this matter of inflammation and impact on the body. But before that, though, how do we access that book?
Okay, well, the book, beyond the prescription, it's not on Amazon right now, unfortunately. It was there, but I had to take it down for various reasons. But it's at the Adventist Book Center in Grand Cayman. They have copies, and I have some other copies there as well. The one for kids, the Power Up, that one is also there, but that one is on Amazon. and Blessing of Suffering is also on Amazon. And so all three books are at the book center in Grand Cayman. So you can get all three of them there. And the Blessing of Suffering and the Power Up, those are on Amazon.
Okay, very well. Now, Doc, you did indicate that you gave a supplement to one of your clients, and it resulted in dramatic changes, not just in one area, but in related areas. We're going to come back to that in a while. I want to ask you about health healing, because you said when you went to medical school, one of the things you wanted to be was a healer. So let me ask you to kind of explain these terms for me. Health, healing, and wellness. Are they one and the same, or are they different?
They're related. Health and healing, they're related. I mean, health is really, it is basically how health, a state of well-being at any particular time. And of course, the World Health Organization described it as, well-being in terms of your physical, your emotional, and your social well-being. So that is really how things are at any particular point. Healing is really about recovery from an illness. So whatever illness that is, but oftentimes we don't really understand that it is something that is an option even in what we call the chronic illnesses. So whether it is a mental illness, whether it is what we call a lifestyle disease, like diabetes, hypertension, but healing is something that can be achieved even in those conditions as well. It's not a life sentence, right? It's something that you can recover from, and your wellness is really it's similar to health. So it's more or less, there's not much difference between health and wellness per se, but it's just that when persons think of wellness, they more look at, those things that will help them to maintain their health, or to achieve their health, especially when it comes on to the natural interventions. So when persons think about wellness, they think about the things that you can do to maintain that health. For example, exercise, sleep, eating properly, those kind of stuff. So it's more looking at the natural side of things. That's the concept that persons have when they think about wellness.
I was a bit intrigued when you said that, in your practice, earlier on in your practice, it was more maintenance as opposed to healing. I mean, I got a cut, I can recover from that, but a lot of the things that you were doing was more maintenance. That's a little surprising to me, because you think of getting sick and going to the doctor, and you get healed and you move on. But so are you suggesting that in the medical field, that a lot of the conditions that people have, that they become content with just surviving? Expand for me, please.
Okay. All right. So one of the challenges with medical treatment is that they don't treat the cause of the problem, right? When you go to the doctor, and let us say you're diagnosed with diabetes, or you're diagnosed with migraine headaches, the medications that are used treat the symptom of the problem, or the manifestation of the problem, whatever that might be. In terms of diabetes, it's a blood sugar. So the medications are really geared towards bringing your blood sugar down. But if you want to look at it as, let us say that you come home and you notice that there's a pool of water in your bedroom. There's no source of water in your bedroom, but there's a pool of water in your bedroom. You can do two things. You can come home, you can clean up the water from off the floor, and every day you come home and clean up the water from off the floor. Or you can say, no, this is something is wrong here. What is the matter? Where's the water coming from? It could be that your bedroom is next to your bathroom, and the piping inside the wall is leaking, and it's leaking out into your bedroom. So you may need to, unfortunately, go inside the wall and repair the damage. That will fix the problem, right? But of course, the approach that is taken in medicine, Western medicine, is that you mop up the water. That's what is done. And every day you mop up the water, right? And so it is not because um, they are, terrible people, doctors, and that's all that they're interested in. That is what we are taught. We're not taught about healing. We are taught about maintenance, right? That is what medications do. And what medications do is that they manipulate the mechanisms in your body to bring about the reduction in the manifestation of these diseases. But there is not the recognition that there's something going on causing this to happen, right? There's no focus on that any at all. And it's because we're not taught about that mindset. That there's something going on that can be remedied, that you can do, that can help persons to recover. And I said, unfortunately, even though a lot of persons may know, and I've been taught many persons this, many persons may know that this is possible, but they are so attached to what they're doing, they're not willing to make the changes necessary. So even when persons know, it still doesn't motivate them enough for them to take that step or those steps.
So I would think that when I go to the doctor and say I have a pain in my waist, that the primary concern would be to find out what is causing the pain, and not just give me relief from the pain. Because my understanding is that you go to medical school, you do anatomy and physiology and a host of other things. So you're raising an important concept there. Traditionally, if I have a headache, let's say, I would immediately wonder, how can I get rid of this headache? Now, most persons may be led to take some medication, and this is what I think I hear you saying. You go to the doctor may say, hey, you want to get rid of the headache, or even you listen to all of these ads, especially on American television, and they tell you, this is good for reducing your headache, that kind of thing. So you take the headache. Now, is this the right approach? And I kind of hear you answering that, saying that's not the right approach, because the headache is probably symptomatic of something else. So when I come to you as a medical doctor and say, I have a headache, I did take some aspirin, I did take some, what are the medications now? Ibuprofen or Advil or something to that effect. But I notice every 2 days the headache comes back. What are you suggesting? That there is something else that is creating that headache? I have to go into the wall and fix the problem?
Okay, no, pain is there are times when, for example, a person may have an identifiable, and I don't want to use the word easily, but something that you can put a finger on. For example, a person having back pains, that person may actually have a slip disc, right? They may have had that injury many years ago, and that over time there are changes that take place in your back that cause the pain to manifest at that time. You may start to develop arthritis. It may also be caused by cancer, right? Headache can also be caused by cancer. Abdominal pains can be caused by cancer as well. So there is that, and of course, as a doctor, you'd have to see whether that is really happening. So based on the person's symptoms, you do the appropriate investigations to see if you can identify those causes. But the thing about it is, let us say that you have cancer. Let us say you have breast cancer, right? And the person comes to the doctor, you have a breast lump, you do the investigation, you find out this person has breast cancer. again, what is often done is that the cancer is treated, right? The cancer is treated, the person may have surgery, chemotherapy, radiotherapy, all of those things. But oftentimes, you find that what causes person to have cancer? Of course, there are genetic factors and all of those things. But there is an environment inside the body that would have allowed the cancer to, to develop and also to grow. And we oftentimes don't find that we focus on that aspect of things. So you may find a person will get the traditional treatments for the cancer, but the other things that allow the cancer to develop may not be addressed. You understand? And so that person may go on to get a recurrence of the cancer, or they may get some other cancer because the background has not been taken care of, right?
So what
So,
I what I hear you saying is that getting medically checked out is appropriate. It is okay,
yes,
the right thing to
yes,
do. But you
definitely.
want to go beyond the traditional treatment.
That's right.
Okay, because I don't want people listening this program to think, oh, okay, I'm not going to bother with doctors anymore. Then maybe you would be out of a job.
Yeah.
So you're saying it's good, it's
Yeah.
appropriate, it's wise to get medically checked out.
Yes.
I kind of like that illustration. I really didn't think about it this way. So if I have cancer, they may remove the cancerous growth. They may give me chemotherapy and radiation to make sure that those cells are dead. But you're saying that in the first instance, it was something about the atmosphere in the body, the environment in the body that promoted the growth of the cancerous cell. And
That's
if
right.
we get to that and treat that, then that will be better. Very interesting, very insightful, in fact. Yes. So let me therefore ask you, I want to go back to this matter of wellness. I think this is right where we are, in fact. We live in an environment, I believe, and this is my conviction, that our environment, our physical environment, is significantly compromised. Contamination and pollution are so widespread that we can hardly avoid the effects. I have this philosophy that some of us who get cancer and get sickness sometimes we can hardly avoid it because, take for example, PVC, that is bringing all the water supplies to our homes, and plastic has so many significant dangerous side effects. We live in this environment where we can hardly sometimes avoid some of these contaminants. So my question is, should this make us despair or should it push us to be more responsible? And what does being more responsible look like?
Well, first of all, when it comes on to their environment, environment is not just external. There's also the internal environment, and that has to do with our homes, because there are certain things that may that will cause the environment in your homes not to be healthy, and it may be chemicals that are used to clean your floor. It may be you may have air conditioning with fragrances in it that you may not recognize that might be affecting your health. It could be mold in your house. There could be chemicals that are used in your furniture, chemicals in your carpets. All of those things can affect you. And we're not even going to make mention about the workplace. That's a whole other thing. And there's the external environment, there's pollution on all of these things. So, and of course, there are things that we use, chemicals that we use, whether it may be the chemicals we use to treat our food, chemicals used to treat our hair, even the lotion that we use, the things that we use on our skin. There are so many things that it can affect us in terms of the chemicals. And so what we should do is, of course, try to do your best to keep your home environment as healthy as possible. And that means that, of course, try and use minimal amounts of whatever chemicals that you need to use. When you're cleaning, you try to avoid using chemicals when you're cleaning. So for example, your bleach and disinfectant, which is a common thing that is used in our homes, those don't necessarily have to be used, and certainly they don't have to be used on a daily basis. They should be used for special occasions. If when I say special occasions, let us say that you have somebody walk into your house and maybe carry some waste material inside the house accidentally. That is an appropriate situation where you need to use it. But for regular washing of hands, you just need to use soap and water. Vinegar you may use to clean your floor. So try and limit the use of chemicals as much as possible. But of course, so you control it as much as possible. You can't do much about your atmosphere unless you're going to move from where you are and go to a different place. And some persons have to do that to achieve improvement in your health. But of course, there are different factors that contribute to us being unwell, and there are personal responsibility choices that we have to make. Your diet, which is a very, very big topic, exercise, getting enough sleep, reducing your stress level, interacting positively with persons, helping persons, getting your fresh air, all of those things are also important for you to achieve. So there is a lot of things that we can do. You can't eliminate all of the negative factors, but there's a lot that is within our control that we can do to improve our health situation and our health prospects.
Now you indicated that there are so many things around, and specifically you mentioned things like some of the common items we use in our homes, air fresheners, lotion, etc. It almost seems tedious for an individual to, be so meticulous in checking out what kind of effect does this have on me, etc. So when we talk about personal responsibility, sometimes you're saying we have to go the extra mile for the sake of our health and our well-being. That's interesting, because one of my observations is that you go to the supermarket and the things that are affordable are not necessarily the things that are good for you. And so you want to make sure you check ingredients, make sure you understand what you are purchasing, because you don't want to be bringing home things that will increase in ill health. And unfortunately, that is what is happening. The things that look very attractive, the things that are really affordable, people consume in large quantities to their detriment. But let me press on. I believe that as Christians, we have a responsibility to be as healthy as we can. I believe this matter of wellness is I want to say a duty for Christians, because if we do not have optimum health, we can't function as efficiently as we ought to for God. So let's be practical now. I want to talk about some practical things. We probably only have time to address one of these issues today, but let's do it nevertheless. Let's talk about allergies. First, what are allergies, and why is it that some persons have allergic reaction to some things and some persons don't? I can be in the same space with my spouse and I have allergic reaction to something and she doesn't. So can you explain what are allergies and why do different things affect different people differently?
Okay, allergies is basically an excessive reaction to a substance which is over and above what is the norm, and it normally, and these are things that are they're not unusual for persons to be exposed to. So, for example, a person may have allergic reaction to peanuts, or to eggs or tin food, stuff like that. So those are not abnormal for us to be having and for us to be exposed to. And of course, the manifestation, it may vary. Some person may have nasal allergies or respiratory allergies, which case they may have things like sneezing, nasal congestion. They may have coughing, shortness of breath, and they may have very severe and life-threatening reactions from those things. And then there are skin manifestations, things like uh, red rashes, bumps, and wales that may develop on a person, and can be very, very itchy as well. Now, persons will have particular things that they might be sensitive to. And this may be genetically predisposed. Then they may inherit it from their parents. For example, we're normally cautious with children who one of their parents is allergic to penicillin, for example. But what you find is that there are some things that are more likely to cause allergies than others. And that is why, we normally look for those things. Whenever a person comes in allergy, we look for those things. So things like, as I said, penicillin is one of them in terms of medication. And things like peanuts, those things are nuts on a whole can cause allergies. Dairy products are very common. They very commonly cause allergies. So there are some common things, right? There's some common things that cause allergies. But the thing is, one of the things that I really want for persons to know is that sometimes persons have a predisposition apart from the genetic factors. There are other things that may make you more prone to having allergies. And sometimes these things are environmental. For example, you may notice that persons are more likely to have allergic symptoms at nights, right? I mean, some person may become more congested at nights. They may itch more at nights. They may cough more at nights. And that's because a change in the timing of the day, especially when it gets cooler. That change from day to night, it triggers a change in your body that causes you to become more reactive to your environment. So that may be a factor. Also, your food. So there are certain foods that will set you up for allergic reactions. So, for example, dairy products. You may not notice that you're allergic to dairy products, but dairy products may actually trigger a reaction that you may not notice. And what happens is that when you're exposed to something else that may be that may cause allergy, you may notice a reaction at that time. You may think that was the second thing that you're allergic to, not recognizing that there are certain things that may make you more prone. Sugar is another thing that does that. So if you have a person that's having allergies, sugar will make you more likely to have that manifestation of an allergy. So it's like the last straw, break the camel's back kind of concept. There's several things going on inside the body, and when you add that last thing, that reaction that you have may become what we call clinical. So it manifests itself, but the other factors are also important. And this is an important concept to understand, because when you're treating a person with allergy, it's important not to just focus on what we say that they're allergic to. So, for example, the dairy products. You have to also look at the other factors that are promoting the manifestation of this problem. And there are others. For example, I want to introduce to your viewers the concept of the intestinal microbiome. And the intestinal microbiome are the bacteria inside of your intestines. And this one we won't be able to get enough time to go through, but just to let you understand that the composition of the bacteria in your intestines, it can affect your immune system, making it more sensitive, and it may cause it to become more reactive to certain things, and more likely to actually develop many conditions. So that is something that I want for you to understand as well. So there are several factors that may encourage the manifestation of these allergies that oftentimes are not paid attention to.
Well, Doc, I want to take my time here because for me personally, I've wondered, a woman has 3 children, same father, same house, one of these children has severe allergic reactions to a number of things. Is it that there is just so if it were genetics, I probably would have said, well, it should affect all three children because the same mother and same father. So what are there other factors that would make one child so reactionary towards whatever it is that is causing the allergies? I am thinking perhaps maybe one child had a C-section. Well, not the child. The child was delivered by C-section as opposed to natural childbearing. But I don't know. Is it just random? That's my question.
That's a very good question, Pastor. And yes, you hinted at one of them, the birth delivery method. It does affect the immune system. And it goes back to the same thing we brought up a while ago, the intestinal microbiome. These are the composition of bacteria in the intestine, especially the large intestine. It is affected by your birth method. So so when you pass through the birth passage, you actually pick up the bacteria inside of the birth canal, and that usually is what starts out your what you should have as your bacteria in your intestines. So when you are born by a cesarean section, then of course this may cause you not to have the correct mixture, and you then pick up the environmental bacteria inside the hospital, which is not really the appropriate one for you. So that is an important thing. And then sometimes it has to do with genetics as well. If you notice that every child looks different, right? You don't, unless they are twins. And it shows you, it gives an idea as to the genetic makeup of each child. It's different. Even though they're just from the same parents, the Lord so designed this whole reproductive process is that even though it is the same pool of genes that you get your genes from, you get if you should have 1,000 children, everyone is going to be different. Everyone is going to be different. That's how God designed things to be, because of how the process takes place. And it's scientific. It's not the time to go into that now. But just to say that you have a different set. And then there are certain things that may happen to a child that may cause them maybe cause them to be more sensitive to certain things. For example, they may have gotten medication that may have changed the intestinal bacteria again. For example, antibiotics, and there are other medications, many other medications that actually affect the intestinal bacteria. So that can actually can affect that child. And then there are certain, because of, again, how we're made up, one child may like something, another child may not like it. And that is not just food, there are activities. Those things can affect our bodies as well, right? The things that we do can affect what's going on inside our bodies. So that also can actually cause one child's body to function differently from another because of what they are doing. And so their activities also, because, for example, you may have a child that likes to clean, right? And so that child may love to clean the house, and that child may use up a lot of chemicals in the process. Another child may not like that very much. They may like outdoors. You understand? Being exposed to outdoors may cause a child to be healthier than the other child. So those things can actually affect how our bodies respond to certain situations.
Interesting. I heard a BBC documentary the other day, and they were saying that some experiments they were doing, and they noticed that if a young child gets a pet, which is either a dog, a cat, or even just goes outside and play in the dirt for a few minutes every day, that they are now observing that that child is able to withstand things like asthma a lot more than other children. So I find that to be interesting. But can I ask you, is it possible that a person can grow out of allergies? So I once had an allergy to peanut, and then eventually I don't have it any longer.
Yes, it is possible. Well, the thing is, again, Um, just want to repeat something I said earlier. There are some foods that are more likely to trigger a response. And my approach is that if you find something, if you notice that there's something which oftentimes triggers allergies, it means that it is generally triggering an unhealthy reaction in you. So even though you may not show that reaction to it, it is wise for you to avoid it. And so if you notice the things that trigger allergic tends to trigger allergies, dairy products, right? Things like um, uh, shellfish as well. These things, it's best to actually avoid them. So because you find that they are generally unhealthy. Chemicals that we use, oftentimes you find that persons may be sensitive, may notice reactions to them. It's best to avoid them as much as possible, even if you don't notice a reaction to those things. And then um, sometimes you may find that things may change inside the person's body. The person may also make changes. So, for example, they may decide to change their diet. Another thing that tends to cause reactions in the body is gluten. Gluten that is in wheat flour, the flour that we use. Those things. So if that person is willing to make those changes, cut down on the sugar intake, make sure they get enough sleep, avoid those other things, make sure they get enough water. Sometimes what will happen is that the sensitivity of their body may go down to the level that they may not notice any reaction, even if they have that thing that they're allergic to before. So there are many things that may actually happen. Sometimes the person's intestinal bacteria may change over time as well for different reasons. And this may cause a person to the sensitivity to go down to the point where they don't notice anything. But what we're saying is that I want persons to just remember anything that you notice triggers allergies in a lot of people is not usually healthy. All right. So dairy products, flour, those things. They are peanuts. They are not things that are really healthy for you. So even if you don't notice any reaction, it's because your body may be reacting to it in a different way. You may not notice that this is causing a problem for you, right? But it's generally best to try and avoid those things.
And I'm surprised that I do know that a lot of people have allergies to peanuts.
Mm-hmm.
But I am still surprised that peanut is in that category because it's a legume.
Mm-hmm.
I understand it's not really a nut, but a
Right.
legume. And I would generally view legumes as healthy things. So that one surprised me a little bit. Well, let's talk about the treatment of allergies. So I discovered that I have allergies. I have allergic reaction to certain things. What do I do? How do I treat it? Do I go to the drugstore and get some medication that would help me? If, pollen is another common. Some people at certain times of the year when there's a lot of pollen in the atmosphere, they become very stuffy and they sneeze a lot, etc. So do I go and get some medication and help me through, or is there another way to treat these allergies?
Well, of course, there is the traditional way of treating allergies. And of course, the first thing is to try and avoid what it is that you're reacting to. That is very prudent. I mean, and it's important not just to avoid the obvious reaction, but there are, I said, those things generally trigger an inflammatory reaction. And what happens is that these foods, they tend to have proteins. So gluten is a protein that is in flour that triggers an inflammatory reaction inside of your body. Peanuts is the same, right? Shellfish also, they have proteins in them that trigger a significant reaction in your body. Some persons may notice a reaction and some may not, right? When they notice a reaction, that's when we call it an allergy. But oftentimes it triggers a reaction that is under the radar, and you may not really notice. So So that is why it's best to avoid them, not just for the allergy, but for your overall health.
So if I may interrupt you, I
Mhm.
hope I don't cause you to lose your trend of thought, but I want to
Right.
go back to this
Mhm.
triggering of the inflammatory reaction in your body.
Mhm.
So if I use peanuts or
Mhm.
flour for that matter, now the
Mhm.
concentration of gluten in flour could vary.
Mhm.
So let's say if I use a lot of gluten,
Mhm.
and it doesn't affect me in any way that I can see visibly, another person may be affected. I think we use the term gluten intolerant or lactose intolerant or those kinds of things. And we talk about the tolerance level. And so a person may have intolerance for a particular thing. Your recommendation is that you cut it out altogether, even if you're not intolerant, or you can use it in moderation, given that it doesn't affect you.
All right, let me give a personal experience that I had. I remember years ago, I made a decision to, significantly reduce, my intake of sugar in my diet and drinks and so on. I don't really follow on those much. I remember some years ago, a friend of mine um was visiting me by the office when I was in Jamaica, and they brought a drink, Malta, to
Mhm.
me. And I had not had it for years because I said I had made a decision to avoid it. Those stuff. And when I had it, I noticed that my nose started running. And I thought it was very interesting because I've never had that reaction to it anytime before. And I kind of realized that because, all right, let us say you have a house, right? And the house is messy, right? And I should bring some dust from outside and throw in the house. You would notice anything because the house is already messy. But if you should clean the house and bring the same amount of dust inside the house and put it in there, you'd see it. And that's what happens a lot of times. It's not that you're not reacting to it. It's just that because of all the other things that you're reacting to, it's going to add to a big pool of reactions that are already going on. So when you clean up the situation, you may notice that you may be having a reaction to it that you may not have noticed before. Um, so it's important to understand that you may not see the reaction, but when you have several things that you're doing that you're reacting to, that reaction may actually cause a problem, right? Which is why we have this term in medicine called chronic systemic low-grade inflammation. And this is one of the primary causes of the chronic illnesses. So what we're saying is that these things, they are causing together. For example, when you have a lot of sugar, processed foods, and dairy, and all of those stuff, a lot of meats, when you have all of those things going on in a person, if you are prone to getting allergies, you may get allergies. If you're prone to getting anxiety, you may get anxiety. If you're prone to getting arthritis, you may get arthritis. So depending on what you're prone to, you may end up with one of those conditions if you have enough of those things. So each one may not trigger a great noticeable reaction, but together you may notice that something is going on.
Very interesting indeed. Insightful. Let me ask you, therefore. Sorry, I did interrupt
Right.
your thought. I was asking you about the
That's
treatment
allergies.
when you
Right.
were.
So in terms of the traditional treatments, depending on where the allergy is, there are many different ways to treat it. And we talk about medical treatment. So if you have nasal allergies, then you may use nasal steroids, you may use antihistamines, and there are other medications that are used to control the reaction. And you do have treatments, for example, where they try to expose you to the allergen, which is what is triggering the reaction in low doses to build up your body's tolerance to it as well. So there are those treatments, and they do have more advanced medications that actually can suppress your immunity. With some biological treatments that have an impact on your immune system. So you do have a wide range of different treatments that are available in medicine to address those things. But from a natural standpoint, what you do is that of course you try and avoid whatever it is, but you also try and avoid other things that may be triggering an inflammatory reaction. So for example, the sugar. So if you notice that you're allergic to pollen, you can't do anything about the pollen. Pollen is always going to be there. So you don't have to now focus on your body. What can you do to reduce your body sensitivity? So you want to reduce your dairy products. You want to reduce your allergies. You want to also made mention of temperature. So try and avoid, limit your exposure to things like air conditioning. You want to reduce your drinking cold stuff, because cooling your body down tends to trigger a reaction as well, especially in people of color. So that's something you may want to limit as well. Avoid the flour, as I mentioned before. Reduce the use of chemicals. So make sure you get exercise, make sure you get your sleep. So just focus on the general stuff. And you find that because there are many persons who have done this that have noticed a significant reduction and sometimes resolution of the allergies that they're having before by making these general changes to their lifestyle. And they may notice that the body may stop reacting to what they were reacting to before.
Okay. A couple of questions. I'm watching our time. We have just about 7 more minutes. Um, a person may like bread, and you say reduce flour. Now, of course, there are other kinds of flours apart from wheat flour. So you may think of buckwheat, you may think of various kinds. So
Right.
there are alternatives. That's the point I want to make. Yes. Secondly, I think it is important for me to ask you this question. I didn't plan to; it just came to my mind, and I say, let me ask you about this, because natural treatment, natural treatment is a good thing, but we live in an environment where there are so many so-called naturalists, if I may say. There is an abundance of individuals claiming to be naturopathic physicians and that kind of thing. And I've heard some say, "Oh, throw away your medication, don't bother with those doctors," and that kind of thing. Can you speak to that? What would be your counsel? An individual listens to this program, they do understand that my first option is not to run and get a painkiller because I'm only treating the symptom. But there's somebody who gives a lecture and says, I'm a naturopathic physician. I did a course, a 1-year course or a 6-month course, and all of a sudden I'm a naturopathic physician. So guide me. How do we make choices with respect to where we turn to when we are ill?
That's a big question. It's important for us to understand, because unfortunately, as I was telling you, traditional medicine doesn't really teach you about healing so much. They teach you about using medications. And it is not that there's not a rule for medications. Yes, I would say if you're having a headache, you make sure you go and take the headache medication. You can take the pain medication. But especially because, sometimes you may be stressed, sometimes you may not have gotten enough sleep the night before. There may be things that are happening to you that may be causing a headache. But if you notice that it is very severe, or if you notice it's causing other symptoms, for example, whenever you have a headache and you start to get vomiting and weakness and all of those things, then you may want to check that out. If it's a mild headache, of course you can take some pain medication to get rid of it. If it's not, so there's no problem with that. But it's not a good idea to rely on it as a permanent solution to that problem. When it comes down to allergies, just go back a little bit. There are things that you can use, natural treatments that can be used to help with allergies. For example, as I mentioned before, the intestinal bacteria is a factor that encourages allergies. So using a probiotic, we're called prebiotics as well. There are also other natural things like reishi mushroom, which is a natural supplement that you can buy on Amazon or Some health food stores may have it as well. There's turmeric also that reduces the inflammation inside the body. These things you can use as a way of reducing your body sensitivity, and that can enhance your immune system. So that is fine. Now, in terms of choosing, I would not throw out either one because they have their value. And so it's important to go to the traditional doctor to get investigations done to see if there's anything readily correctable. For example, a headache. You may have a brain tumor. I'm not saying that's not the most likely cause, but to rule out the more serious causes like that. And of course, get some pain medication. But it's important to make changes to your lifestyle, and that is where the naturalists may have an advantage because they have more knowledge over those diet and lifestyle changes that you need to make in order for you to achieve that wellness that you're looking for. So they both have a value. Some naturalists may also be using herbal treatments at a person may be more they may have a greater liking for using those natural treatments. So they both have their value. Of course, the more training that you have, a 1-year course is probably better than a 6-month course. A 5-year course is probably better than a 1-year course. So the more training a person has, is the more competent they are. And of course, the institution that of course they train that is important as well. So the more credible their qualifications are, is the more competent then they tend to be in managing, your health situation.
But so it sounds to me as though a person who has a medical background and combines that with a natural approach is probably at a serious advantage.
I would say the same thing.
Very well. Now in a minute and a half, this last question, if I can squeeze it in. Some allergies are minor, others can be very serious and even life-threatening. If, for example, you did mention earlier, a person is allergic to penicillin and a doctor does not know it and gives a penicillin injection, it can be very serious. Where do we draw the line between a local home treatment and professional treatment with respect to some of these allergies?
Well, certainly, I would not recommend that. Unless you have been treated by a doctor before and you've been told how to manage. But once you start to develop symptoms of allergy, you should go to a doctor to get treatment. I would say to a traditional doctor for treatment, at least to understand, what may be causing it and also what are some things you can do. If you have medication, and the doctor may tell you, if you should get a reaction again, you can use this medication. So if you have been guided, and it's a mild reaction, then you can treat it at home. But any severe reaction where you get a lot of itching, a lot of redness, coughing, shortness of breath, compromise of the airway, restriction in the airway, those are symptoms that you definitely have to go to a doctor for because that can be life-threatening.
Okay, well, that's all the time we have. More questions, but our time is up. I want to thank you so much, Dr. Street, for sharing with us. We have lots of other things to talk about, so I'm hoping we can have a part 2 and even a part 3. We want to talk about inflammation. We want to talk about some of the more common things. What happens if I have a fever? Should I run to the doctor? Should I be concerned? Those kinds of things. And how but we will follow up on those things. Thank you so much. For those of you who are listening, Let's Talk, of course, is here every Sabbath afternoon. We discuss issues impacting the church and the wider community. We encourage you to keep listening and to tell a friend about it. God bless you. Until next time.